Hello. Good evening. Hi, everybody. Hi, Joni Block. It's nice to see you.
I think we can't hear you, Joni.
That's because I'm on mute. So I was just going to say, Joy, I was going to say hello to you. I'm glad to see you. I haven't seen you in so long.
I know it. I know it. It's nice to see you.
You too. You too. Look at all our friends here. Let's see who else is here. Been busy, EEC?
We sure have.
Yeah, no, Carol, you're never busy.
I don't know what you're talking about. We will start in just a moment. We still have more people coming in through the waiting room, so we will get started in just a minute.
Buenas tardes a todos. Comenzamos en un par de minutos. Todavía tenemos personas que están entrando.
Okay, Reed, I think we can go ahead.
Welcome, everyone. My name is Reed. I'm with the team of interpreters for tonight. We do have language services for English and Spanish. In just a moment, everyone will see a globe icon right at the bottom of their Zoom screen next to the word interpretation. This is where you can choose your language, either English or Spanish. If you've joined from a cell phone or a tablet, you can click on the three dots button right next to the more option, and from there choose your language. We do strongly ask and encourage everyone here, whether you speak English or Spanish, when you see this button in just a moment, please click on it and choose your preferred language for this evening.
Buenas noches a todos. Me llamo Robinson, soy parte del equipo de interpretación de Excel Linguistics. Bienvenidos todos. Esta tarde vamos a tener servicios de interpretación entre inglés y español. Por favor, en un par de minutos usted va a ver un icono con un globo en la parte inferior y selecciónelo y escoja el lenguaje en que usted va a participar. Bien sea que usted habla español o inglés, cada uno debe seleccionar para poder escuchar en la reunión. Gracias. Si usted va a utilizar un teléfono celular, encuentra el icono con los 3 puntos y ahí tiene las opciones para seleccionar el lenguaje. Gracias.
All right, so everyone should be able to see that globe on their screen now and choose either English or Spanish. Ahora todo el mundo debe poder ver ese icono de un globo en su pantalla de Zoom y seleccionar su idioma preferido.
Okay. Excellent. So thank you all for being here and welcome for our engagement session with families on child care tuition subsidies. We're very grateful to have you here. And tonight we're going to talk a little bit about EEC's strategic plan goals around subsidy and access. We're going to give a very brief overview of EEC's child care tuition subsidy program, and then the good part where we get to have a discussion and hear from you and learn from you. So first, talking a little bit about our subsidy systems and our strategic planning activities. There are primarily 3 main audiences that EEC works with. That includes families, it includes programs, and then individual educators. And everything that we do at EEC is working towards ensuring equitable access to high quality early education and care programming across the Commonwealth. Now, to make that happen, EEC works closely with educators and with programs to ensure that there are safe environments for children to learn from highly qualified staff. And we work to support families to identify high quality education and care programs that meet their needs. Our goal overall, which you see on your screen, is that children are on track for success in school and to reach their full potential, and that their families are empowered to work, build their skills, and attain economic mobility while supporting their children's education and development. I'm going to pass it on to Carol to talk a little bit about our current subsidy system.
Good evening, everyone. So we want to give a very short overview of our subsidy. So the Massachusetts Child Care Tuition Subsidy Program assists eligible families with children ages 0 to 13 to help pay for their child care costs. To be eligible for our program, families must show that they are low income and have a reason to need child care, what we typically call a service need, which means that they're working or in school or a training program for a minimum number of hours. Eligible families who apply for child care subsidy receive that tuition support if there's available funding from EEC and there's available child care slot with a provider who accepts subsidies. Going to the next slide. So we, wanted to give an overview of our intentions for the tuition subsidies. The goal of the strategic plan is to increase access by addressing affordability and availability, and by building community capacity to support families. Through these, we have some action steps that we've been looking at. Increase access for families who need tuition subsidies to afford childcare. Increased number of providers who accept our subsidies to improve the choices and the options for families, and to eliminate steps and barriers for families as they try to access our tuition subsidies.
So now is the time already, it has arrived for us to hear from you, which is really the most important part for us of tonight. So I'm going to pass it over to Eli to explain how to participate tonight with engagement.
Thank you, Joy and Carol. So there are a couple of ways that you can participate in the questions that we have tonight, and we encourage all of you to please use one of these so that you can respond to the questions and ensure your feedback is incorporated into EEC's planning. And so the first way is to actually scan the QR code here on the screen with your phone, and that will then take you to the link to participate in the survey. You can also participate using texting. So if you text to 22333 and use the code early education, all one word, that will then enroll you in the survey participation. And when you type in responses, they will show up on our survey. And then finally, you can follow the link that's listed there, and that will take you to participating in the survey. And I will just also put a live link in the chat so that you can follow it there as well. And then we will ask several questions, about 5 questions over the course of the next several minutes. And for each one, as you add responses in, we will see them on the screen. So we encourage all of you to participate in putting the link in the chat right now. And we already have a question up, so please go ahead and start responding once you're connected. One moment. So the question, I'm going to go ahead and display screen now, Joy, so that you all can read the question.
Thank you, Eli.
Of course. Okay.
Okay, so our first question for tonight is, what challenges have you seen among families that are wishing to access affordable childcare? What are the challenges that families are facing when they're coming to access affordable childcare?
Joy, this can relate to affordability overall as well as participating in tuition subsidies, correct?
Absolutely.
Okay.
Absolutely. Long wait lists and transportation. Yeah, we're hearing a lot about these two areas. Wait list and overly complicated process and system. It feels like a fortress. That's a great way to communicate that there are barriers in place just through the process itself. And definitely the wait list we're hearing. The biggest challenge that we see is the process of finding a place to use the voucher and how slowly that happens. Often families will get a voucher, but then the CCR&R is difficult to connect with, and the time it takes for this process is way too long, and parents end up missing out on opportunities. Thank you so much for sharing that. That's really important to hear. No choice for programs that meet family needs and is conveniently located. There's a lack of infant care and overall lack of parent choice within the options that are available. Impossible for people who don't speak English. So there are barriers based on language availability and access. Thank you. Very few options for school age programs and dwindling, it seems. So seeing less availability there in general. Excellent. Kids with disabilities have nowhere to go and providers can't afford extra help to meet these kids' needs. So really thinking about the services that we're providing and how we're able to respond to the needs, the community needs, particularly for children with disabilities. Great.
I think we'll move to the next question.
Excellent. So the next question is asking, what kind of support would help more families to access affordable childcare? So we talked a little bit about what are the challenges specifically. Now we want to know what kinds of supports would actually help to facilitate engagement and access for affordable childcare. And we can think outside the box. What are the supports that would be available, should be available to help more families? Great, keeping virtual appointments that came to exist. So thinking of the lessons that we learned during the pandemic and seeing how we can carry forward things that helped to improve access. Simpler process and more help finding providers. Also make transportation more widely available. Excellent. Excellent. What are some other supports that would help families access affordable childcare?
I wonder, Joy, should we ask what parts of the process could be more simple or how the matching should be done?
That's a great idea. I would love to hear about specifically what parts of the process are too complicated and need to be simplified, and in what ways could we help with finding providers. Someone said clearer communication. Someone had no idea what the state of their voucher was when schools closed last March and had to call an elected official to help learn what was happening. So making sure that we're really transparent and communicating with families directly about their childcare options and any changes. E-signatures, many CCR&Rs are not offering them. So making sure that we can use digital signatures in our forms. Excellent. I think we've heard a lot about that and the virtual option. So making sure again that we can carry forward sort of the lessons learned during the pandemic. Excellent. Someone wants to echo the need for transportation. Thank you.
Okay, we might be at the end of our, oh no, there's a little more.
Another one for better communication with CCR&Rs. So a theme here to really focus on how we communicate, maybe the cadence of communication, the mechanisms through which we communicate, literally how we're communicating with families and the communication between the CCR&Rs and the families. This is really helpful. I think we slowed down now. Eli.
Okay, we'll go to the next question.
All right, great. So when looking at this one, we're really trying to find out, where do families go, or who do they turn to when seeking affordable childcare? As we look at our subsidy system and other options for affordable childcare, where do they really go?
We have one response in the chat. I wonder, Robinson or Jimena, if you could translate or interpret.
Of course, if you can just put it up on the screen, because I didn't get it.
Oh, sorry, it's in the chat. Let me see if I can find a way to do that.
I'll look for it. I'll look for it.
Okay,
That's fine. Because us, the providers, don't get paid for a special needs kid the same as a non-special needs kid.
Thank you.
Back to the current question, just looking for any ideas people have about, who families really look to, who they trust, who they know to go to when they're seeking affordable childcare. All right, Mass 211 was the most helpful when trying to apply and understand. That's great. New families often look towards a local community agency or program at first. So it's really good to know, to kind of make sure we're thinking locally and make sure that we're focusing on that. Health center social workers. So ones they're working with through the medical community. That's great. Legal services, great. Yeah, that's a very valid, very good resource where families get a lot of different access to things.
Maybe if we just add a question, are there ways that you would recommend that information is distributed? Are there places where it's not available, but it should be?
Mm-hmm. Great, and then adding in, many times family childcare providers try to help, so also making sure that they're included and involved. Early intervention could be a good way to get information out. That's great, especially, really hitting those families with children under the age of 3.
Okay, I think that might be the end of responses for this question. We'll move to the next one.
Sure.
Oh, no.
No. Many families are using social media when searching. Okay. All community outlets where families go. These are all good. Oh, for WIC and things like that. So trying to coordinate with those other benefit programs to have information in the same location. That's great.
Okay.
Okay, so really looking back at our subsidy system and really trying to get into kind of more specifics as we look for things to improve. And so we're trying to see if you do you see any barriers for families when they try to enroll in a childcare tuition subsidy? Obviously, there's been some comments about virtual visits, about language, about e-signatures, and just what ideas you guys have is really big picture or smaller picture ideas for barriers for families. I would
Thank
even say, I'd even add on if there's any ideas that's not necessarily a barrier, but maybe something that could still increase access and for families trying to access the system.
Are there points at which you have seen families become frustrated in the process of trying to access a tuition subsidy? Or you as a family member, if there are those of you who are participating who have tried to access and gotten frustrated, what were the barriers or what were the issues or problems that we should think about?
Trouble providing actual work time. Employers must give unpaid breaks, but this time in the work schedule doesn't show up. Okay. Some families find it still too expensive when health insurance and other costs are not included. It's a very good feedback. Wait list is the biggest barrier. A similar income point, basing eligibility on gross income, so not taking into account those other costs that a family might have. So documentation, lack of valid IDs, proof of address for one or both parents are often a struggle, as are making appointments during work hours. So try to make sure that we have those, different appointment hours on nights, on weekends, and things that can help parents.
Jimena, we have another comment in the chat if it's possible to translate. Or Robinson, Jimena, is one of you able to translate the comment in the chat? Oh, here, Reed has translated. Sometimes people without Social Security.
No. Yeah.
Oh, go ahead, Jimena. Yes.
Yes, I'm sorry. Sometimes people without a Social Security, they don't have a way to prove their employment.
Mm-hmm.
Great.
Great. So not using interpreters consistently is leaving families out. So back to that language access and making it that much more of a barrier for those who don't speak English.
Before we move to the next question, are there any other frustrations, barriers, things that stand in the way when families are looking for support for tuition? Okay, we'll go to the next question.
All right, so our last one is just, is there anything else that you wish to share as we kind of look at family access and access to the tuition subsidies and removing barriers and increasing access and affordability and even access to programs and things like that? Even anything else you have for if you'd like to weigh in on tonight?
It's possible we've covered it all. Oh, there we go.
Asking to prove where our father is living, if not in the home, is a huge problem. Okay, thank you. Making it feasible for extended day programs to run. My district had to stop accepting vouchers and now I'm stuck for childcare for my school age kids. Very hard as a single mom. Really appreciate that feedback.
All right.
So-
Well, yeah, sorry, go ahead. Eva.
No, Joy and Carol, I will leave this question open so people can continue to provide their thoughts over the next several minutes.
Great, thank you. I'm going to come back to sharing my screen and want to be very clear and sincere that you are literally the most important voice at the table as we're thinking about all of our regulations and how we can improve our system and be more intentional about responding to family needs. And we really appreciate that you took the time to be here tonight. But if you're anything like me, you might think of things later on, and we'd love to hear from you if that is the case. So we've created this additional survey just to capture any following thoughts that may come, any ideas that you have in terms of things that could be improved upon. Maybe you want to share something that worked that we should be encouraged to do more of. Please feel free to share all of your thoughts through this link. And thank you again for being here tonight. We really appreciate it.
Okay, should we say goodnight?
I think so.
Okay.
Thank you all.
Have a
Good
great
night.
night. Thank you for attending.
Bye-bye.
Take care.